Common aging changes. We will be covering chapter 5 on today, and we'll be talking about the changes that our bodies go through as we age. There are many common aging changes that do occur, and we will discuss that today. There's changes in the body cells. Cell numbers reduce, leaving decreased number of functional cells. Lean body mass also decreases, and so the person has more adipose tissue. That lean, strong muscle tone body mass begins to decrease. Changes in the body physical appearance also changes. This begins at the age of 40. Hair loss. You have hair that becomes gray. The skin loses its elasticity and it becomes wrinkled. Loss of tissue elasticity also has elongated ears, baggy eyelids, and even double chins begin to occur at this age. Changes in the body's respiratory system. Reduction in respiratory activity begins to occur. There's calcification of costal cartilage. The trachea and rib cage become more rigid, makes it very difficult for the older adult to take nice deep breaths. Also, this attributes to pneumonia, why the older population in general are at higher risk for developing pneumonia because they don't have the ability to inhale and exhale because of the rib cage and the becoming much more rigid and inflexible. Changes in the body cardiovascular system. Valves become thick and rigid. They're not pliable. They don't have the ability to stretch as well and retract. Blood vessels reduce elasticity, so again there's no flexibility in the blood vessels. That flexibility that was there when we were younger is no longer there. It's still flexible, but not as flexible. Oxygen used less efficiently. The demand for the oxygen is still there, but it's not being used as well in our bodies. Changes in the gastrointestinal system. There's a decreased esophageal motility. That's why you have a lot of people that are older that are suffering from GERD. That's the gastroesophageal reflux disease. They can eat, and once they're done eating, if they don't sit up for an hour after eating, anywhere from 30 minutes to an hour after eating, you will find that they have this regurgitation of the meal, whatever they've eaten. Spicy foods are not good for the older adult. Fried foods, again, not good for the older adult. And part of the reason is because of this decreased esophageal motility. Atrophy of the small and large intestines begins to occur also. The men that could eat large meals can no longer eat the large meals anymore because of the shrinking of the small and large intestine. Decline of renal blood flow occurs in the urinary system, and the glomerular filtration rate decreases by 50% by the time an individual is 90 years old. Reduced bladder capacity also occurs. We're not able, as we age, our bladder is not able to hold as much urine as it once did. The reproductive system, there's a reduction for men. There's a reduction in sperm count. The prostate enlarges also. Also, there is erectile dysfunction that occurs with aging. For our female, the atrophy of the valvula, dried vaginal canal, estrogen depletion also occurs for the older female. And these are changes that are irreversible. There's absolutely nothing we can do to stop these things from happening. This is a normal part of aging. Changes in our musculoskeletal system, a reduction, there's a reduced muscle mass, strength, and movement. There's a decrease in bone mineral and mass. And part of the reason for our height shrinkage is because of this reduced muscle mass, reduced decreased bone mineral mass as well. And so that's why a 6 foot man, 6 foot, I'll make him 6'10", well, make him 6'4", a 6 foot 4 inch male, by the time he is 70 or 80, may now be 6'2". And part of the reason is because of the reduced muscle mass and the decreased bone mineral and mass that occurs with aging. Changes in the body, nervous system. There's a decline in weight and reduced blood flow to the brain. It does not affect thinking and behavior. The only time that our thinking and behavior is affected is if it's in the presence of a disease process. For instance, dementia or Alzheimer's disease or vascular dementia or Lewy body dementia. Those types of dementia will and can contribute to effective thinking and behavior. But just in general, a normal part of aging is decline in weight and reduced blood flow to the brain. There's a reduction in neurons, nerve fibers, and cerebral blood flow that is a normal common part of aging, and it is to be expected. Changes in body sensory organs, vision. The pupil size reduces and has less reactive to light. Depth perception is distorted, which makes it very difficult for our older adult to drive at night. The glare of the oncoming traffic can also affect the depth perception. Hearing, there's a distortion of high-pitched sounds. That's why it's hard for the older adult to hear and really understand a women, because our voices are so high-pitched. They hear male voices or deep voices much better. And then taste and smell, sense of smell altered with age. Safety issues also become a problem with taste and smell. Taste acuity dependent on smell. So if they don't have the ability to smell, then the food, they don't necessarily get the full flavor or taste of food as well. Touch, reduction of tactile sensation, which makes it very dangerous sometimes, and especially if it's in the presence of disease like diabetes, where there's already been an issue with blood flow to the extremities, to the hands. They become numb. They don't realize if they touch something hot, if they burn themselves, they don't realize that it's there. And part of that is because of this reduction of tactile sensation. The endocrine system, thyroid gland activity will decrease. The pituitary gland decreases in volume. Insulin released by the beta cells are delayed and insufficient. Again, with this, out in the presence of disease, you have what we call type 2 diabetes. In absent disease, this insulin released by the beta cell delayed and insufficient could contribute also to blood sugar levels being a little higher than normal. In the integumentary system, the skin elasticity has less elasticity. The skin is dry and fragile. There's a decreased subcutaneous fat layer that's up under the skin. As we age, we are at higher risk for bruising, higher risk for skin tears, higher risk for pressure ulcers as well. It's very important. We talk about bathing and good hygiene, but for our older adult who is aging, they probably should only bathe 2 to 3 times a week where they take a shower or a tub bath because the hot water can be very drying. The best time to lubricate the skin is immediately after a shower or after a bath because the pores are open and really can absorb the cream that is being applied, the lotion or cream that is being applied. Skin is very fragile. It is the first line of defense, so we need to make sure that we lubricate, keep the skin nice and moist so that skin stays intact. Changes in the immune system. The T cell activity declines. Cell mediated immunity also declines, which puts our older adult at high risk for catching viruses, bacterial infections. They don't have the ability to fight off infections with that decline in their immunity system. That's why part of the teaching that we do for our older adults is we tell them that they should have a flu shot. They should, if they're at risk for developing shingles, they should go get vaccinated. A lot of things are preventive measures that we take with our older adult. Flu shot, pneumonia shot, shingles shot, those types of things. Changes in the mind. The personality remains consistent with that of the earlier years in the absence of disease like dementia. Memory, age-related forgetfulness is a normal part of aging, and it does occur. Intelligence, basic intelligence is upheld. Crystallized intelligence is maintained. Those are things that you've learned over your lifetime. It's not something new. As you get older and learn something new, that may be a little different. Learning, the ability usually not changed. If you had the ability to learn when you were younger, you still have that ability.